Well, good evening, everybody, and welcome to another edition of Ask the Doctor. Tonight, we're going to learn holistic strategies to combat depression and anxiety, which is definitely something I want to hear. The man of the hour has taught doctors and patients for many, many years, teaches, trains, lectures all over the world, and we are lucky to have him teach us here tonight. And please put your questions into the chat so we can ask him at the end. Without further ado, the amazing Dr. Bob Rakowski.
Well, Carol, thank you always for hosting and your beautiful introduction. They say a picture's worth 1,000 words, but now we know with brain scans, it's worth about 2 million words. So this is my 31st year in clinical practice. I've treated world champions from every major professional sport, 50 different Olympians, and I've seen the other end of the spectrum. This foot was given a death sentence. It was scheduled to be amputated 2 days from the day that picture was taken. But look at it 2 weeks later. And with the right protocol, I believe we can bring any tissue back quickly, by the way, including the brain. And so I use that picture there at the end of Alzheimer's. Dr. Dale Bredesen wrote that book, and he has a program where he can reverse dementia. And they've done it now thousands of times. But I was at the conference where he presented his preliminary research. I'm a family man, and as Carol said, I've lectured, taught over 10,000 hours of continuing education seminars for doctors on 6 different continents. So when we start looking at depression, I want to let you know that sadness and depression aren't the same. You know, life is going to have its highs and its lows. We're going to have some times of sadness, and that doesn't necessarily translate into depression. Depression is long lasting, and it can be really debilitating. There's loss of interest, reduced self-confidence. A lot of times people think of suicide, you know, if this is all my life is going to be, then why live it? Low mood, low energy, guilty thoughts, poor concentration, disturbed sleep, appetite, all of that, and even more. And sadly, the world is experiencing more depression now than ever. We're also going to talk about anxiety. And I have a little different take on that. When we talk about the brain, there's 2 major categories of neurotransmitters. There's pick-me-ups and there's calm-me-downs. Well, the anxiety brain doesn't have enough calm-me-downs. It's kind of stuck in a little bit of overdrive. And that's why you're have anxiety and worry and racing minds, and you can't concentrate, and you're very, very irritable, and you stay awake, hard time sleeping. That itself will lead to fatigue and restlessness, and then that snowballs into other things in the body that can manifest as soreness and weakness and other things like that. Interesting statistic. I looked at Mental Health America, and they looked at things were going on, and basically what they said is, with the pandemic going on, it's the highest levels of anxiety and depression they've ever seen. It's fueled by loneliness and isolation, and alarming numbers of children reporting thoughts of suicide and self-harm. Dr. Scott Atlas with Stanford is on record, and he's got good data to back it up, that the policies have cost the globe 25 times the number of life years than the virus itself. And that's even with inflated viral statements. And so what a life year means is if someone at age 80 gets the virus and dies, and they were scheduled to die when they were 81 anyways, according to longevity tables, well, they lost 1 life year. But if you have a 30-year-old person that, you know, lost their job, became depressed, and doesn't see a better future and takes their life, well, they've lost 51 life years. So that's how that adds up. And sadly, you know, the policies have been absolutely disastrous. When we start talking about anything, I always teach my students that patients want to know the answers to 4 questions. What's causing the problem? Not what do we name it, but what's causing it? They want to know if we can help. And by the way, it can be challenging to get depressed people to help themselves, but if we can show them a little light, a little hope, and a fast response, we've seen some epic responses. How long will it take? People want to be better yesterday. I have some strategies where we help them, you know, significantly most of the time, you know, in about 10 days. And I let them know, if you can give me 10 days of good effort, we can make a big difference. And then cost, well, that depends on how much we do. And in terms of how long it takes, I tell people bodies respond to frequency, duration, intensity, quality, and timing of stimuli. And it takes a little bit of investment to get out of it. When I teach doctors, I tell them I also want to know the answers to the questions: how complex is the case? How strong and resilient is the patient? Is there anything in the chemistry you need to address? Is there an unresolved trauma or infection, or is there anything else? True depression is definitely complex because the individual is not in a very proactive state, and they definitely need to make some changes to move forward. So, some nurturing, some hand holding, some accountability, some follow up, some love and support, and some hope are the best things that we can give. I like this book by psychiatrist Daniel Amen, and it's called The End of Mental Illness. And he asks a major question: what if mental health was brain health? Well, they're pretty closely related. If you do the things to keep a healthy brain, you're going to have good mental health as a general rule. And we'll talk about some of those things that we're going to do. His TED Talk was entitled What I Learned After 83,000 Brain Scans. And here's what he learned: you can change people's brains. And in fact, when you change your mind, you literally change your mind. So he's a big fan of imaging the brain. And what he will tell you is that prior to brain scans, the psychiatric profession, they were the only medical professionals that didn't examine the organ that they were treating. And so you start looking at this, the brain is certainly the center of focus. And these are two scans of the same person, once in a grateful state, once in a hateful state. And what Daniel Amen will tell you, you can clearly see the difference, but the difference is not good. In fact, the hateful brain will have a lot of problems over time staying in that circumstance. And he talks about what's known as neuroplasticity, that the brain is constantly rewiring based on the input, based on things that we are doing. So you've heard me mention the deadly quartet: stress, toxins, malnutrition, physical inactivity. These are all very strongly tied to depression, anxiety, etc. We're going to focus more on depression at the moment. We'll talk a little bit about anxiety. So when you start talking about cortisol, the hormone of chronic stress, you look at that, over 8,500 studies on the links between cortisol and depression. And this reference goes back a ways, but even back 30 plus years ago, this reference said there's universal agreement that 50 to 75% of major depression is associated with chronic overactive stress. And I wonder if that number's even higher today. In fact, they suggested that 75% of all doctor visits were related to stress. This is for my biochemistry fanatic friends. I don't know how many of them are out there watching this at the moment, but I found this fascinating, wondering how many biochemists work for how long to figure out all of these pathways. But there's an amino acid called tryptophan. And once tryptophan goes up this pathway here, it becomes something called 5-hydroxytryptophan. It becomes serotonin, which is a happy chemical, or it could become melatonin, which is profoundly health promoting and calming. But under circumstances of cortisol and inflammation, tryptophan goes actually and drives down a pathway that stimulates something called quinolinic acid. And that actually drives glutamate. And that is the most excitatory neurotransmitter in the brain. That creates brain imbalance in fight or flight mode and is associated with anxiety. So a body that's constantly stressed and constantly inflamed is going to be an anxious body and brain. And ultimately, we want to lower the stress and take care of the things that cause inflammation and minimize those. I certainly have my favorites. I'll give you a comprehensive nutrition protocol before we're done. But my favorite superfood on the planet is Ganoderma lucidum, phenomenal for brain health. And there's a model of depression which is hard to beat. It's called the social defeat model of depression, where they basically put a much smaller rat near a bigger bully rat. And basically it's bullied its entire life. And it gets really depressed and doesn't feel like it has much of a life or future. Interestingly enough, when they gave these animals Ganoderma and still exposed them to the bullying, they were able to not sink into such a deep level of depression, and were even able to get out of it. So a stress reset, I tell when I teach doctors that this is something that I think is my biggest clinical pearl in the last 15 years. I have people take 1 to 2 milligrams of melatonin every waking hour for 7 to 10 days. And by the way, I did have an extreme case that I did for 21 days. Theanine, 100 to 200 milligrams every waking hour, and Ganoderma spores every waking hour. And the PubMeds that you're going to see there, melatonin actually puts the brakes on the brain's drive of stress on the adrenal glands. Theanine is a GABA facilitator that naturally calms anxiety and creates a more relaxed brain. Ganoderma improves serotonin for happy, dopamine for happy, GABA for calm, and acetylcholine for memory. But it also calms the body through the parasympathetic nervous system, the brain through GABA. And it's even called the herb of spiritual potency. So that's in the medical literature, and it's fascinating language. It also improved levels of happiness and satisfaction and reduced depression. It seems like those go together, but those were called out in that study. You start looking at toxins and depression. We've got 75 plus years of studies linking toxins to depressions, almost 6,000 plus studies. And the one that came up first actually talked about the microbiome. And believe it or not, you have more brain chemistry in your gut than you have in your brain. And the bugs in your gut affect gut chemistry, body chemistry, and brain chemistry. And they know that if you do a fecal transplant from a depressed mouse into a mouse that doesn't have that microbiome, they actually start to develop depressive type symptoms. So definitely the gut is a big factor there. And there's the toxicity issue. So when we start talking about Ganoderma and the microbiome, it reduces the obese microbiome and a whole lot more than just that. Obesity is considered the biggest problem in the world, no pun intended, but over 40 studies on Ganoderma and the microbiome since 2015. It's great for the immune system. We'll talk about why that's really important. And understand that obesity creates chronic inflammation, and that sets the brain up for anxiety and depression. When we look at the symptoms of chronic poisoning, these have been long published. Fatigue, sleep disturbance, intestinal distress, allergy symptoms, headaches, confusion, and anxiety are all the symptoms of chronic poisoning. And so when I put together protocols, I tell people that bodies respond to frequency, duration, intensity, quality, and timing of stimuli. And this is a graphic of the liver, and you start looking at all the nutrients that are called out in so many different places. I let people know that detoxification is nutrient dependent, energy dependent, and protein dependent. So the protein comes in phase 1 of liver detoxification, the cytochrome P450 enzymes. These are all proteins. All enzymes are protein. By the way, they're also pH dependent and things like that. So you come to realize that it takes a lot of balanced nutrition to get the body to detoxify. So I use a medical food shake specific for detoxification. It provides all those nutrients and more. I have patients do 7 to 10 days of these nutrients and organic vegetables. And I recommend a good detox twice a year. And ultimately understand that a toxin is a poison. It disrupts the brain and body. And it's actually estimated that everybody walking around has at least 700 toxins in their body. So there's toxins in the air, the water, and the food. You want to be as clean as possible, but you also want to be diligent about cleaning out your body. And then people think of the liver, but there's also the skin and the bowels and the kidneys and the lungs. And by the way, my favorite superfood, Ganoderma, good for all of those systems and making it a phenomenal detoxification aid. When you start talking about people that are depressed, they often reach for comfort foods. And they actually find out that this actually makes them worse. It causes blood sugar spikes, more inflammatory process, even can aggravate addiction to sugar, which is probably the top addiction on the planet. 94% of rats prefer processed sugar to cocaine. And so now, instead of calling it comfort eating, they're calling it discomfort eating. And that can lead to obesity, ill health, and malnutrition. The Global Nutrition Report 2020, malnutrition is the leading cause of death globally. No big surprise there. And this, by the way, is responsible for about 60% of the deaths on the planet. That's the casual estimate of this. So it seems that if this is the biggest problem and the biggest cause of death, we really ought to have a widespread effort in teaching people how to get good food, how to optimize their nutrition. Over nearly 13,000 studies, over 12,000 on nutrition and depression, again, going back about 75 years. And notice this first study, it says nutrition and behavioral health disorders, and highlights both depression and anxiety. And again, those are circumstances that are triggered by malnutrition. The Global Nutrition Report says every single country on planet Earth is affected by malnutrition. And the math on this works out very, very easily. We know that for optimal health of plants, animals, and humans, there's over 30 minerals that are required. But farmers have used for about 100 years of top fertilizer of 3 elements: nitrogen, phosphorus, and potassium. And I tell people, you don't have to be a math whiz to realize if you pull 30 out for every 3 that you put back in, eventually you're going to have a problem. So sometime in the early 1900s, they started using this. Then it really took off after 1950. And top fertilizer on the globe. And they've suggested, with the way they've depleted the soil, this was in 2014, that they may have only 60 years of farming left. We also know, by the way, that nutrient value impacts satiety. If people don't get the nutrition they need, they're always hungry. And malnutrition, therefore, is a cause of obesity, which is a cause of chronic inflammation and stress, and therefore related to depression and anxiety. So I created my own nutrition pyramid around 2000. At the base of it is nature's foods. If God made it, it's okay. If man made it, stay away. Then we have superfoods, the consensus top superfood on the planet, gannet or molluscidum. Functional foods. For the brain, we tend to either do those that are really good at pulling out toxins, or possibly those that modulate the inflammatory process, or possibly those that are good for blood sugar as well. Those are the 3 big enemies of the brain. A good multivitamin, multimineral, because we all tend to be nutrient deficient. Omega-3s, especially the activated forms with resolvins, probiotics, and a combination of D3, K2 put us at the top of the pyramid. I'm going to make a little deviation here. If we look at nutrition and the immune system, almost 34,000 published studies going back over 110 years. And then there's this term called psychoneuroimmunology. And very simply, we've known now, again, for over 75 years, that the same chemicals that affect the nervous system also affect the immune system. And so vice versa. If you stress your immune system, you stress your brain, you stress your brain, you stress your immune system. And here's quite simply, I like the summary of what it says. The brain can interfere with the immune system, where chronic psychological stress may inhibit the functions of the immune system. Chronic peripheral inflammation clearly interferes with brain function. This can lead to fatigue or even overt or extreme psychiatric illness. So everything works together. And finally, exercise and depression. Over 23,000 studies. This one goes back 125 years. So they started looking at exercise and depression 125 years ago. In this book, The Joy of Movement by Kelly McGonigal, phenomenal book. Basically, they talk about the average daily step count required to, it says, induce feelings of anxiety and decrease satisfaction with life, if I read that right, 5,649. It's amazing that they were that precise. If you don't walk that much, if you don't take that many steps, you will likely be depressed and or anxious. And then she goes on in the book to say that across the globe, the entire average of steps is much less than that. So I'm a big fan of measuring things. The Fitbit, I've committed to 10,000 steps every day this year. I probably got it 98% of the days last year, but I'll get it every day this year. And I'm on a 77-day stress step streak. So this was an interesting study out of Harvard. They looked at people that were clearly clinically depressed. One group got Zoloft, the second group got exercise, the third group got Zoloft and exercise. And 6 months after the study was done, only the people that had exercise only were still improved. So somehow the Zoloft negated the benefits of the exercise. And, I've always said that there's two pharmacies, man's pharmacy, God's pharmacy. God's pharmacy is clearly superior if you know how to use it. Man's pharmacy always has a downside. And then finally, when you start looking at antidepressants, they work almost about the same as a placebo. So, if they're damaging, if they're toxic, if they remodel the brain and they're only slightly better than placebo, well, probably not the best way to go. When it comes to moving right, pain and fatigue are the top reasons that people don't move. So there we have my favorite superfood again. Ganoderma modulates the inflammatory process by over a dozen mechanisms. It also increases energy of electron transport complexes. That's in the brain and in the body, so it makes for a better brain and body. And it even reduces the horrific pain of fibromyalgia. A powerful study there. Double-blind placebo-controlled trial of it versus the top drugs, pain relief for rheumatoid arthritis. So it's quite good there. And a number of brain benefits, especially for that happy neurotransmitter, serotonin and dopamine, the calming neurotransmitter, GABA, and the neurotransmitter of memory, acetylcholine. It also induces brain stem cells, is anti-Parkinson's and Alzheimer's, and even anti-seizure. So that leads us to questions, if we have any in the chat.
Well, everybody has been paying complete attention and they have not typed anything in the chat yet, so we'll give them a couple of seconds. And while we do that, does anybody have a quick hand they want to throw up?